So part 2 is looking at just the real imaging. So again, central sulcus, anterior to central sulcus, frontal lobe, and this is a precentral gyrus, primary motor cortex. Postcentral gyrus is a primary sensory cortex, right? And then anterior to this, forming a gyrus, there's another sulcus, which is a precentral sulcus, and the posteriorly postcentral sulcus. These precentral sulcus, central sulcus, and postcentral sulcus, these sulci are parallel. So these 3 lines are parallel coming posterior to inferior, posterior superior to inferior. These parallel lines are going down like this towards the Sylvian fissure. There's another sulci, superfrontal sulcus, inferior frontal sulcus, and the interparietal sulcus. Those are the different orientation, more to the perpendicular to these 3 central sulcus, precentral and postcentral sulcus, right? So there is a confluence between superfrontal sulcus and precentral sulcus, and interparietal sulcus and postcentral sulcus. So that's characteristic features of the orientation of the sulci. If you identify those sulci, you know where you are in the suprasylvian regions. So let's do this. This is the axial plane of the MRI scan. If you look at the brain is like a round oval-shaped structure with interhemispheric fissure in the center, right? So you have always superfrontal sulcus go anterior-posterior orientation, and then interrupted by precentral sulcus. So that's always you can see interhemispheric fissure. Parallel to the interhemispheric fissure is anterior-posterior orientation of the sulcus. This is superfrontal sulcus interrupted by precentral sulcus. Posteriorly, you have interparietal sulcus, which is this space. This space is interrupted by the postcentral sulcus. So that if you want to identify the central sulcus is in between. So you can see, you can use this orientation of anterior-posterior orientation, which is superfrontal sulcus and interparietal sulcus. And then you have a right to left orientation of sulcation. Anterior one is a precentral gyrus and posterior one is a postcentral gyrus, right? So that's how you can see as a unit. You have to use most superior portion of the slices. If you go down there, central sulcus can get very, very shallow. So if you look at this slice, for example, it's very hard to see which one is central sulcus. But if you go higher up, you see nicely, this is the central sulcus. So once you define the central sulcus, you can see that this homunculus map is a very strange human figure, because face is here in the kind of inferior portion about the ventricular level. And then hand is very, very large. And then you have body, and then lower extremity is in the medial aspect. So the midline portion of the pre and post central gyri, this is the motor and sensory of the foot or lower extremity. And then the large portion is the hand. So, and then plus you can see the little knob here. This is the thumb of the center of the thumb. So hand have a very large surface compared to the foot or even the face, because you can imagine you do many things in the fine motor functions. You need to have lots of motor information has to be concentrated in your hand, because that's how you make a pie, or you can write, or you can cut, or many things you do in your hand. You don't do this in your face, right? So that's why the surface of the hand has to be very large. So you see the more insinuated shape of the sulcation in the motor and sensory function of the hand and then thumb portions. Once you get the level of the ventricle, this is where the face component of the motor sensory cortex. In the midline, again, you can see the corpus callosum, which is very easy to define. Around the corpus callosum is a cingulate gyrus, which is divided by cingulate sulcus. So cingulate sulcus goes around the corpus callosum here, and then you can turn onto the surface of the brain. This turned around portion is called cross-marginal sulcus. Central sulcus is just anterior to the cross-marginal sulcus ending, because you can see the cross-marginal sulcus ending is here, and the central sulcus is a small sulcation just anterior to it. So this one here around this small notch of the central sulcus, anterior to it the motor, posterior to it the sensory, and then you can kind of see a sort of round shape structure here. This is called paracentral lobule. Paracentral lobule is the lower extremity center of the motor and sensory cortex. So the most common thing you can see in the real life is you have a parasagittal meningioma pushing the paracentral lobule. Then you can get the lower extremity weakness, for example. So where is the Broca's area? Broca's area is a motor expression function of the language. So most of the language centers are dominant hemisphere, which is on the majority of right-handed people, and then most of the left-handed people are on the left side. So the left hemisphere is the majority of the people's dominant hemisphere. So look at the left hemisphere. This is the right side, this is the left side of the patient. And then you can see the frontal horn of lateral ventricle always curves around like this. And then you just put the arrow laterally, and then this is the Broca's area. So that's a kind of easy way of identifying this. But eventually, the Broca's area are defined as inferior frontal gyrus. And inferior frontal gyrus has a pars triangularis, pars opercularis, and pars orbitalis. The Broca's area corresponds to triangularis and opercularis. Well, how to define that this portion is, if you look at this slice, you have a sulcus, deep sulcus, arising from the insula surface to the surface of the brain. So this is the one who traversing from the deep to the surface, right? This one is called vertical branch of the cerebral fissure, which corresponding this sulcus is right here in the sagittal plane, right? So this vertical branch of cerebral fissure is easy to find because this is only one who traverses from the surface to the insula component, right? Find this one, and then you see the posterior to it, this is a pars opercularis. Anterior to it, this is a pars triangularis. So these two components, that's the Broca's area. So that's how the anatomically the defined Broca's area. I mean, language zone is, if you look at the functional MRI and then do a different testing, it's much more complicated, but basic zone you have to look for is this pars triangularis and pars opercularis. And then only thing you have to do is you go to the mid portion of the lateral ventricle and then find this sulcus, which is the vertical branch of the cerebral fissure. Broca's area is around this fissure. Okay. Wernicke's area is a posterior portion of the superior temporal gyrus. Okay, superior temporal gyrus is underneath the cerebral fissure. It's easy to see on the sagittal view, right? Sagittal view, find the cerebral fissure. The inferior to it, this is the temporal, superior temporal gyrus, and posterior half of the superior temporal gyrus, that's the Wernicke's zone. In axial, you can see the atrium of the lateral ventricle, which is kind of triangular shape ventricle. And you just draw a line to lateral, and then this gyrus, this is the Wernicke's area. If you wanted to see the anterior border of the Wernicke's area is the posterior commissura. So posterior commissura is, here's anterior commissura here. This is a posterior commissura. The Wernicke's zone doesn't go beyond usually the posterior commissura. So in axial plane, you can see you can delineate well the Wernicke's zone in that way. So you know now the language zone in axial and sagittal, Broca's and Wernicke's, right? moving on to the parietal lobe. So parietal lobes are, one is postcentral gyrus, and then the other one is inferior parietal lobule and superior parietal lobe, right? So superior parietal lobe is a maybe better seen on sagittal view. So you find the parietal fissure goes obliquely. This one is posterior to this is the parietal occipital lobe. That's how this is called parietal occipital fissure. And then we saw the cingulate sulcus, which delineates cingulate gyrus and frontal lobe, right? This is the paracentral lobule. Small notch is the central sulcus. So posterior to supramarginal sulcus here, between the parietal fissure, this is the superior parietal lobule, okay? And the inferior border is just kind of follow the cingulate gyrus like this. This is called subparietal sulcus here. And then this component here is kind of quadrangular shape lobe is the superior parietal lobule. Now, in occipital lobe, this is a calcarine fissure, which is primary visual cortex. And occipital lobe right here in medial aspect has two lobes. Inferior to the calcarine fissure is lingual gyrus. Superior to is in this triangular shape is called cuneus, right? So this superior parietal lobule is anterior to the cuneus, so this is also called precuneus. That's kind of nickname, but this is part of the superior parietal lobule. So precuneus is the important structure because that visual information goes to the sensory motor cortex. So that's the spatial information goes in. Alzheimer's patient, oftentimes you can see the functional deficiency in the posterior cingulate gyrus. So in this component is very well known to have a volume loss in the Alzheimer's disease. So if you have this pathway is affected, this is the one who have problem of where you are, right? So that's why the precuneus can be very important in a way of the neurocognitive function of the patient. You can see in axial is right here and coronal is right here. Inferior parietal lobules are two gyri. One is supramarginal gyrus, the other is angular gyrus. So supramarginal gyrus and angular gyrus, those are the heteromodal cortex, which has a language and then calculation and all these reading type of high functionality. And to define this is, I like using a sagittal, for example. So you follow the cerebellum fissure because everybody can find the cerebellum fissure. End of the cerebellum fissure, you just draw a round line here. So this is a supramarginal gyrus. So you just follow the cerebellum fissure, end of the cerebellum fissure, around this structure is a supramarginal gyrus. Angular gyrus located posterior to it, just follow the superior temporal sulcus. Superior temporal sulcus is a parallel line to the cerebellum fissure. Right? So, for example, this is the supramarginal gyrus. You can see the end of the cerebellum fissure here. And then supramarginal gyrus is right here. Is if you look from the center of the brain, this is orientation of about 4 o'clock. That's the supramarginal gyrus. Angular gyrus is posterior to it. Right here is angular gyrus. Angular gyrus around 5 o'clock orientation. This is AVM, arteriovenous malformation in the brain. This is kind of posteriorly located. That's the parietal lobe. Well, in the parietal lobe is this superior parietal lobule or supramarginal gyrus or angular gyrus. Well, superior parietal lobule is medial to the interparietal sulcus medially, so this is the superior parietal lobule. AVM is more lateral. And then if you look, this is about 5 o'clock. 5 o'clock is the angular gyrus, right? So this is the AVM of the angular gyrus. Temporal lobe is underneath the cerebellum fissure. So if you look at the laterally, you have 3 gyri parallel to it, superior, middle, and inferior temporal gyri. divided by superior temporal sulcus and inferior temporal sulcus. That looks pretty easy, right? But the temporal lobe has more inferior orientation, it's kind of circling around. So the most inferior surface is called fusiform gyrus, because this shape is like a fusiform. Most medial aspect is a parahippocampal gyrus, because hippocampus is sitting on the top of this parahippocampal gyrus, right? So superior, middle, inferior temporal gyrus going towards and then forming the temporal pole, and then the inferior surface is the fusiform and the parahippocampal gyrus. Fusiform gyrus is extended from temporal to occipital lobe, and there is no temporal portion or occipital portion. There is no separation. It's just sitting there in between temporal and occipital lobe. Parahippocampal gyrus continued to be occipital lobe component, and then this is called lingual gyrus. So occipital component of most medial aspect, continuation of parahippocampal gyrus is a lingual gyrus, right? Because this is kind of surrounding orientation around the temporal horn, so it's easy to see in coronal. If you cut this is a coronal view, then this is a superior temporal gyrus, middle temporal gyrus, inferior temporal gyrus, fusiform gyrus, and parahippocampal gyrus. And the hippocampus is sitting on the parahippocampal gyrus, right? And then, so, but we usually look at the not the coronal, but axial view. So if you really wanted to identify superior, middle, and inferior temporal gyri in axial view, you just see superior temporal gyrus is the level of the thalamus. So when you see thalamus, then this is superior temporal gyrus. Middle temporal gyrus goes along the midbrain level. So if you see the midbrain, which is like a Mickey Mouse shaped structure here, if you see the midbrain, laterally, this is the middle temporal gyrus. And medially, you can see the hippocampus. You see, that's the hippocampus. The inferior temporal gyrus passes the level of the pons. When you see the pons level, this is inferior temporal gyrus. And medially, that's parahippocampal gyrus. So this way, you can kind of identify all the temporal lobes. Primary auditory cortex called heterogyros. Heterogyros has a very particular shape. So you see, again, the coronal view, superior, middle, inferior, and fusiform and parahippocampal gyrus here. And then if you look at the medial aspect of the superior temporal gyrus, you have a little kind of knob or round structure here. So this knob is a heterogyrus. Heterogyrus has a right and left side on both sides, and usually the dominant hemisphere is heterogyrus is larger as this case, right? In sagittal view, you can see the insula here. So here is cerebral fissure, and the heterogyrus is located in the posterior portion of the insula. In axial view, you can see the atrium lateral ventricle. Here is a Wernicke's area here. Heterogyrus has this rectangular, obliquely oriented gyrus. So this is a heterogyrus. So you can identify, because this is a very particular shape. Occipital lobe is medial aspect is easy to see because you can see the parietal fissure dividing parietal lobe. This is PRECUNEUS and occipital lobe. Calcarine fissure is this kind of the transverse line of the fissures, and this is the primary visual cortex. Above is the cuneus because the triangular shaped lobe, and then the inferior to it, this is the lingual gyrus. This is all occipital lobe. Lateral portion of the occipital lobe is there's no strict delineation, so you have to go from the parietal fissure portion to the lateral small notch, which is called a preoccipital notch. So preoccipital notch always have a vein in it because the vein of lobe drains obliquely from the cerebral fissure to this occipital notch and then going into the transverse sinus. So this notch is the one who is dividing laterally the temporal lobe and occipital lobe. In the imaging, you can see the parietal occipital fissure here and then calcarine fissure. you can see that this sagittal view is much easier, but in coronal view, you can see the both calcarean fissure and parietal fissure like this. So superior to the parietal fissure is the parietal lobe, inferior to the parietal fissure is occipital lobe. Axially, you can see the small vein here. This is anterior occipital notch or pre-occipital notch. So posterior to this is occipital lobe. Anterior to this is a temporal lobe. And then this is where the vein breve enters to the transverse sinus. So that's the quick anatomical review of all the anatomical structures. So